Back to On the Beat, everyone, and today we are talking to Dr. Aamir Hashmat from Monroe Regional Hospital, the Hamilton Clinic, and this week's edition of On the Beat here, we're talking about brain health and neurology. Doctor, I appreciate you joining us this morning.
Thank you very much.
All right, we'll jump right in and talk about memory loss and some of the diseases that can kind of come along with that. What is the difference between dementia and Alzheimer's? Because both are, pretty commonly known and used, but people may not know exactly what the difference is.
Absolutely. It's a very important question. A lot of people have in their mind the confusion regarding dementia and Alzheimer's. So dementia is a broader terminology which means memory loss and loss of thinking. And there are several causes of dementia, and one of the most common causes is Alzheimer's disease. There are several other causes too, like vascular dementia or Lewy body disease, frontotemporal dementia. Certain vitamin deficiency can cause memory difficulties, and thyroid disorders also can cause, but the most common cause is Alzheimer's disease. So dementia is a broader term, and Alzheimer's disease is one of the cause of it. Okay,
and if somebody would present to you, how would you maybe test the difference between, I guess it's blood work involved to
No, I think it's more pattern. When we get the history from the patients and the family, the pattern tell us, which way we are going and what is this.
Okay. All right. So speaking of pattern, what are the early signs of Alzheimer's?
So the early signs of Alzheimer's are primarily is memory loss and loss of thinking. And also with this is speech difficulties and word finding difficulties, and basically impairment in the reasoning and judgment is the most common early signs.
Okay, so in terms of Alzheimer's disease, we've covered kind of the signs, but what would maybe cause somebody to experience some of these symptoms?
So the cause is basically still unknown, and scientists are still researching, but if we see that early onset and the late onset, in the mid-30s and mid-60s is the early onset dementia, and there may be some genetic component, but in the late onset, mid-60s onwards, is primarily environmental factors and is primarily sporadic cases that we see.
All right, so in your practice or in your expertise, which one is more common? You would say the late onset
is more common.
All right, so for the stages, you mentioned early onset and late onset. Are there any other stages of the disease?
So the disease is characterized or divided into 4 stages. It's a preclinical stage, mild stage, moderate stage, and the severe stage. In the preclinical stage, the brain changes been going on there, but patients are pretty much symptoms-free. In the mild stages, they have primary loss of thinking, loss of reasoning, judgment, and some speech difficulties. But as the disease progresses in the moderate range, the speech difficulties gets worse and worse and more confusion, and they cannot recognize their own family members and friends. And the final stage, they lost communications completely, weight loss, and loss of appetite, and they require tertiary care.
Unfortunate there for sure. And I guess maybe the important or most important question, is there a cure or a way to prevent this disease?
So unfortunately, we don't have any cure yet, but we are still working. The scientists are working very hard to find some. But FDA has approved several medicines to slow down the process and some behavioral issues to treat, and which literally helps a lot. But it does not change the outcome, though. It just delays the process.
Well, promising future, potentially, as the
Absolutely.
research continues.
Absolutely.
Dr. Hashmat, we sure appreciate you joining us this morning. And for more information from this session, you can head over to the website there listed on your screen, Monroe Regional Hospital, Hamilton Clinic. Again, Dr. Aamir Hashmat joining us today. That's the latest here on the Beat, so we'll be back after this.